Hello, Dr. Sharma.
Hello.
Hi, welcome to your speaking role play. I will be taking the role of a patient or a relative. You will be taking on your own professional role as a doctor. The purpose of the speaking role play is to get evidence of your ability to communicate with the patient. Try to use your ability to fulfill as much of the role play as possible. Do you have any questions? No. So I will give you your scenario now, and you have 3 minutes to prepare for your scenario. You will start your role play once the 3 minutes are over. You can make notes on the role play card, but you must give this to me at the end of the role play. So there's your information for your first role play, and there's a pen. You can make some notes if you want to. You can start preparing now. That's the end of your 3 minutes. Are you ready for your role play?
Yes.
Okay, you can start.
Hello. Is that Anna, Mrs. Shah's daughter?
That's right, doctor, yes.
Hello, my name is Bhavna. I'm the medical registrar in this hospital. Do you know what's going on right now?
I'm just really confused, doctor, because how is she now? Because when we brought her in the ambulance, the crew was saying that we're wasting her time and that she's not going to survive. So why would the ambulance crew say something like that? What's going on? We're not sure what's going on.
So I know you just need to get an update as to what the situation is right now. So I'll try and go through everything in this brief meeting. Just to get a background, what do you know till now? What's going on?
I'm my mother's main carer. She's had Parkinson's for a very long time, and with that she has lots of problems passing urine, and we've been in and out of hospital for that. Last time they said she's also got something called heart failure and some lung problems as well. So I know her breathing isn't very good. She's also been having a catheter in and out, and that's caused her lots of infections. So, you know, she's dealing with that as well. But she's really confused, and last night she was so confused she even had a fall. So it's like she's forgetting everything, and it's like her health is just going worse and worse, and we don't really know what's happening.
Well, your mom is unwell. She did have a lot of problems in the past, especially with the dementia, with the recurrent urinary tract infections. I saw from her notes that the last time she was with us, she did develop a resistant bug in her urine.
What does that mean, doctor?
That means that the antibiotics that we have, we start with the simpler antibiotics and go on to the complex ones. Usually we start out with the simple ones because most people respond to them, but your mom grows resistant bacteria which don't respond to the usual ones, and we have to put on very strong antibiotics.
So is she on strong antibiotics?
Yes. So right now the treatment that we are giving her is for something called sepsis.
Sepsis is dangerous, doctor.
Yes, it is a critical situation. Sepsis basically means that the body's ability to fight infection is impaired, and the body is then doing abnormal things to its blood pressure, to its heart rate. So mom right now doesn't really have a good blood pressure. So we're giving her something just to help pump her heart. She's confused right now. She's not drinking enough water.
Yes,
so we're giving her IV fluids just to help her deal with this infection in a proper way. It's just that it is a very likely possibility that she will go downhill from here. Right now we're doing everything that we can, but there's a very strong possibility that mom gets unwell overnight, and then she might not survive this admission.
Oh dear, doctor. I wasn't expecting this kind of news.
Well, I'm sorry that I'm bringing this news to you, but it's just that so that we are aware of what we are doing right now. It's very important for you to know.
She's not understanding any of this now, so I mean, what do we say to her? How do we explain all of this to her?
She is confused right now. Last night she was agitated as well. And you mentioned about falls at home, so she is at risk of falls. So we are giving her medications to help control pain, to help control the agitation. So we're trying to make her as comfortable as we can.
We just want her to be comfortable, doctor. We don't want her to be any pain.
We have involved someone called the palliative team. I know palliative sounds very end of life, but palliative team is a team which helps us deal with patients who might be at risk of dying.
Okay.
So they help us give them medications to help with pain, to help with agitation, to help with breathing.
So she will be comfortable then. So she'll be as pain-free as possible.
Yeah. But you shouldn't think that we are giving up on her. Another thing that I just wanted to discuss with you, have you ever spoken about CPR with
CPR looks horrible, doctor. I've seen it on TV and it just looks horrible. It doesn't look very nice, especially on somebody who's so frail. What exactly is it? It doesn't look nice to watch.
So basically CPR stands for cardiopulmonary resuscitation. It's when a person stops breathing and the heart stops working. So what we do, we try to manually compress the chest.
But that might break her ribs?
Yes, that is a very unfortunate side effect of doing CPR. And another problem with CPR is that even if she comes out of it, the blood supply to her brain isn't the same as an average person would have during that time when she's getting those chest compressions. So when she comes out of it, she's not going to be the same. There is a large possibility that she develops some kind of what we call a hypoxic brain injury. That is the brain getting less oxygen, so the brain cells dying.
Oh dear.
So she would be worse than what she went in with.
But are you going to be stopping all the treatment now?
No, we aren't stopping treatment. We are giving her antibiotics. We are giving her fluids. There is a possibility that if she develops fluid overload, we'll remove that and we'll give her something called inotropes just to help with pumping the heart and maintaining the blood pressure. But with regards to CPR and going to ITU and having a tube put down in her mouth to just help her breathe when she's not going to come out of it, we don't think it would be the most dignified way for her.
It's all very much, doctor. I wasn't expecting this news at all, but I think as a family our main thing would be that our mum is comfortable and that she's pain-free, and she's had a good life. She's 90 now. She's had a good life. So if the doctors feel that this is the best thing for her, and we don't want her to be in any pain and have any of this CPR, so as long as she's comfortable, then you can go ahead and do what is the most dignified thing for our mum.
I'm sorry that I'm bringing this news to you again.
Thank you.
Another thing is that in case she does deteriorate overnight, it would be helpful if you want to inform the other family members so that they can have a look.
Yes, thank you, doctor. Yes, that's a good idea. I let our families and friends know that it's not looking very good, and they can come and visit. But thank you for your time, doctor. Thank you for talking to me. Thank you.
Thank you.
Dr. Bhavna, that was the end of the role play. Thank you very much.
Hi guys, this is Bhavna from Teacher Academy, where we teach the OET exam by medicos for medicos. Right, so today was a very difficult scenario. This will probably be the most difficult scenario you can have on your OET exam, and possibly when you come and work in the NHS, this will be a very difficult clinical communication, but probably you'll have to face it a lot of times. So it's good that you start preparing now. As you guys remember what we discussed in the last video, that the OET exam is an English exam. It's not a medical exam, but you are judged on two criteria, which are the linguistic criteria and the clinical communication criteria. The clinical communication criteria become really essential in a case like this, where you're discussing a dying patient and you're discussing DNACPR and escalation plans. So make sure that you prepare a sensitive description of what you're going to tell the patient's relative. When you're talking about a patient dying and you are the patient's doctor, make sure you're not lying to the patient's relative. You give them a clear picture of what exactly is going on. Imagine if this was your relative, you won't want the doctor to give you false hope. dealing with death, if you spread your pain over a period of time, it's just a little easier to deal with rather than dealing with a sudden death when the doctor has been telling you everything's fine. So just make sure you don't do that to your patient or your patient's relative. Another thing which is very, very important, guys, please read your task very carefully. Make sure you don't mistake that the person in front of you is the patient himself. It might be the patient's mother, father, daughter, son, aunt, uncle, might be their nephew. So make sure you don't mistake that relationship, because then you're going to lose a lot of points in the introduction part of the clinical communication criteria. Please do not ask them what their date of birth is, or how is their health, or how are they feeling right now, because that is, again, that is not the patient that you're talking to. You're talking to a relative. Another thing which is quite important, make sure you know which place you're in. The OET exam, you'll be going into a chamber, you won't be in a clinical setting, but you need to understand what the task is calling for the clinical setting to be. So make sure you understand if you're in a GP's office and you're making anticipatory decisions regarding DNACPR for palliative patients, or whether you are in a medical ward, or whether you are in the community. So make sure you understand what your scenario is, who you're talking to, and where you are right now. Then we go through the task. The task will probably call for you to first talk about the dying patient, which we've already covered. Second possible portion of this task can be discussing CPR. So you'll have to explain what CPR is in simpler terms. You can either use my approach, or you can try and prepare a description for CPR in your own words, but just be prepared so that you don't mess it up. That's how your linguistic criteria is judged, and that's how you score marks for fluency, accuracy, and pronunciation. So make sure you do that. Another thing which is really, really important is understanding and incorporating, which is a part of the clinical communication criteria. So make sure you understand the relatives' concerns. Maybe they'll ask you, if the patient's dying, do they need to call the rest of the family if they want to see them? Maybe they ask you, will this patient deteriorate overnight? Maybe they'll ask you, can we stay with the patient? So all of these questions are very important to be answered. If you don't do that, you're going to lose marks. The second point, if you do that in real life, it's really, really insensitive, and you should understand that if it was you in the patient's relative's place, how would you feel? It's not important to say sorry again and again. It's important to understand where the relative's coming from, what is happening to their to the patient, and what will be the plan from now, and using understanding language, using body language, using words like I understand your situation, that is an understandable concern, I can see that you're distressed, if I was in your place I would feel the same. So those would help convey sympathy better than just saying I'm sorry again and again and again. It just sounds very irritating if you do that. Make sure at the end, the clinical communication criteria does involve summarizing the information. That's when you give a brief summary of what's going on and what's the plan from now on, and that's when you answer all the final questions. So this scenario is a difficult scenario, I agree, but if you are prepared and you know what the clinical communication criteria are, you will be more comfortable, and you won't make simple grammatical mistakes and score poorly on your linguistic criteria as well. So just prepare the scenario really well, and I'm sure you'll score really, really well. So that's it for today. In case you have any questions, please use the comment box below, and please like, comment, subscribe. Good luck. Thank you.